Dr. Guleria, thank you so much for joining us on the NDTV Lifeline podcast. To begin with, आप हमें बताइए कि what really is sleep apnea और हमारे देश में इंडिया में कितना कॉमन है ये?
स्लीप एपनिया इज़ वन ऑफ द स्लीप डिसऑर्डर्स जो हम काफ़ी कॉमन मानते हैं. अनफॉर्चुनेटली इट इज़ नॉट रिकॉग्नाइज्ड.
जी.
क्योंकि हमारे देश में ये लोग सोचते हैं कि अगर कोई जोर से खराटे मार रहा है या दिन में सो रहा है ये नॉर्मल है. लेकिन स्लीप एपनिया इज़ अ डिजीज़ विच कैन लीड टू मेनी प्रॉब्लम्स. इट इज़ नॉट ओनली अबाउट स्नोरिंग. तो स्लीप एपनिया में होता क्या है, अगर हम वो समझने की कोशिश करें, तो जब स्लीप एपनिया किसी को होता है तो जब हम सोते हैं तो हमारे मसल्स रिलैक्स करते हैं.
जी.
तो जो गले में मसल्स हैं, थ्रोट के मसल, जब वो रिलैक्स होते हैं तो आस्ता आस्ता सांस की नाली पास आने लगती है. और क्योंकि वो पास आते हैं और हम सांस ले रहे होते हैं तो जोर जोर के खराटे मारते हैं, क्योंकि वी आर ब्रीदिंग थ्रू अ नैरो ट्यूब. फिर एक समय आता है जब वो सांस की नाली बिल्कुल कोलैप्स हो जाती है. सांस लेने की कोशिश कर रहे हैं लेकिन सांस ले नहीं पा रहे, और ब्लड में ऑक्सीजन कम होने लगती है, कार्बन डाइऑक्साइड बढ़ जाता है, और उसके कारण बॉडी सिस्टम में फ़र्क पड़ता है. लंग्स और चेस्ट वॉल जो है वो एक क्लोज्ड अपर्चर के अगेंस्ट ब्रीथ करने की कोशिश कर रहे हैं और सांस नहीं जा रहा है. हार्ट पे प्रेशर पड़ता है, सिंपैथेटिक नर्वस सिस्टम पे स्ट्रेन पड़ता है, और जो सो रहा है वो डीप स्लीप से लाइट स्लीप पे आ जाता है. लोगों को पता नहीं चलता कि उनकी स्लीप जो है वो डिस्टर्ब है, लेकिन दे कम फ्रॉम व्हाट वी कॉल डीप स्लीप टू लाइट स्लीप. एकदम सांस की नाली खुलती है और फिर वो सांस फिर लेने लगते हैं. जो उनके साथ उनके पार्टनर है वो ये ऑब्जर्व करते हैं कि वो देखते हैं कि जोर जोर के खराटे मारे और एकदम सांस रुक गया, फिर एकदम झटके से सांस लिया और फिर सांस लेने लगे. सो ये स्लीप एपनिया है. तो ये इट्स नॉट ओनली अबाउट स्नोरिंग, इट ऑल्सो अबाउट डिस्टर्बेंस ऑफ योर होल सिस्टम, लो ऑक्सीजन, हाई कार्बन डाइऑक्साइड, metabolic syndrome, and strain on the heart also.
I want to obviously ask you how it impacts the different organs, like you rightly said, because it's not just sleep, right? It's obviously impacting the other body parts. But to begin with, if you can tell our listeners and viewers, what are the warning signs that one should be looking out for?
Yeah, so first is people feel it's not common, but if you look at data, हमारी कंट्री में जो स्टडीज़ हुई हैं, बहुत स्टडीज़ नहीं हुई हैं, लेकिन जो स्टडीज़ हुई हैं, they suggest that as we look at the older population, almost about 10 to 20% of people in the general population have sleep apnea. So it's not a small number. काफ़ी बड़ा नंबर है. दूसरा ये समझने की ज़रूरत है कि हाउ डू वी रिकॉग्नाइज, जैसे आपने पूछा. तो आई थिंक द इम्पॉर्टेंट थिंग टू रिकॉग्नाइज इज, वन इज लाइक आई सेड, लाउड स्नोरिंग. समवन हु इज स्नोरिंग वेरी लाउडली, डोंट थिंक इट्स अ नॉर्मल थिंग, कीप दैट इन माइंड. एंड इफ लाइक आई सेड स्नोरिंग में बीच बीच में सांस रुक रहा है और आप फिर एकदम गैस्प कर रहे हैं और फिर सांस ले रहे हैं, दैट कुड बी अ साइन ऑफ स्लीप एपनिया. देन डे टाइम स्लीपीनेस, बिकॉज यू आर गेटिंग व्हाट वी कॉल फ्रैगमेंटेड स्लीप. स्लीप आपकी इतनी पूरी हो नहीं पा रही रात को, तो आप सुबह जब उठते हो आप फ्रेश नहीं फील करते हो, गले में खराश रहती है, ड्राइनेस ऑफ थ्रोट होती है. दिन में यू आर नॉट एबल टू गिव गुड अमाउंट ऑफ अटेंशन, और बैठे बैठे नींद आ जाती है. आप गाड़ी में जा रहे हो, यू आर ट्रैवलिंग इन अ व्हीकल, यू गो ऑफ टू स्लीप. टीवी देखते देखते लोग सो जाते हैं. तो डे टाइम स्लीपीनेस, नॉट फीलिंग फ्रेश इन द मॉर्निंग, सोर थ्रोट और पेन इन द थ्रोट व्हेन यू गेट अप, एंड लाउड स्नोरिंग are all features which can be suggestive of obstructive sleep apnea.
So those are the signs and symptoms, and this is, Dr. Guleria, something very close to my heart because I've seen my dad experience it. आप जो कह रहे हो ना, बैठे बैठे सो जाना, चाय गिर जाती थी, and he would just say that you people are imagining. But since he's been on a CPAP machine, his life quality has improved. So I mean, what you're saying I totally understand, and like you said, it's under recognized.
Correct.
What is the way to actually diagnose sleep apnea? Is sleep study the gold standard?
Yes. So once we have person who has these symptoms, and there are various ways of doing it. एक तो जैसे मैंने कहा, अगर symptoms हो, there are also questionnaires which one has available, which are validated, which can help to make a diagnosis कि this is likely to be sleep apnea. But the gold standard is a sleep study. And you must do a full polysomnography, जो हम sleep study कहते हैं. Now with technology having been advanced, we can now do sleep studies even at home. Initially when we started doing sleep related research and work, we used to do it in the hospital. It used to be a hospital-based study because it was a very large machine and you had to hook the patient onto that machine. So now the
convenience is there that अपने घर बैठे
बैठे हो सकते. Home-based sleep studies can be done, and now you have screening tools also, where simple devices can be put which are not that cumbersome. जो sleep, they can give us a rough idea whether you have sleep apnea or not, and detailed sleep study can subsequently be done.
And what are there different types of sleep apnea जो लोगों को होती है?
So अगर हम sleep apnea की बात करें, एक तो जैसे मैंने आपको बताया कि सांस की नाली रुक जाती है. There is also what is known as central sleep apnea, which happens in some people who have heart problem and others. कि your respiratory brain में respiratory drive becomes less, and you're sleeping, and then you suddenly stop breathing because the stimulus from the brain becomes less. So rather than obstructive sleep apnea, is known as central sleep apnea. And some people have a mixed of the two, which is a mixed pattern, जिसमें central sleep apnea भी है और obstructive sleep apnea भी है.
So ये भी पता कराना जरूरी है what kind you have, so
Correct.
that you're treated the right way. I think that's again a big
So that's
gap.
why the sleep study is required to see is it obstructive, is it central, or is it a mixed pattern, and if it's a mixed pattern, which is the dominant pattern.
Okay, Dr. Guleria, आपने हमें समझा दिया कि everything about sleep apnea, right? Signs, symptoms, how to diagnose it. Now coming on to the impact, because we take it so lightly, जैसे आपने बोला snoring है तो बहुत common चीज़ है या खाली senior citizens को होती है. How does it really impact the heart, the other organs of the body? मैं कहीं पढ़ रही थी kidney पर भी impact होता है. So if you can just tell our viewers that.
So I think two things I'd like to say. One is sleep apnea is not loud snoring. It can impact almost all organs of the body. First important thing. Secondly, it is not something which is seen only in older age group. Long time back, we did a study. We started looking at school children, and we looked at school children who were overweight. And we found that those school children who were overweight, a lot of them had features of sleep apnea. And in all of them, there were features of metabolic syndrome. The sugars were on the higher side, cholesterol was on the higher side, and these are school-going children. So it's very important
So
to understand.
बच्चों में भी sleep apnea.
So बच्चों में भी sleep apnea हो सकता है. So it's important that we're not talking of adults, but children also who have it. One important risk factor that we must understand, although it's not in everyone, is obesity. Because if you are obese, अगर मोटापा है, so there is more fat deposited around the neck, and that also leads to the airways becoming more narrow, and उससे sleep apnea होने के chances होते हैं. Similarly, अगर आपका neck short है, so you are obese and your neck is short, then also the airways can collapse. Some people who have some degree of structural problem, jaw छोटा है या कुछ और tonsils हैं, adenoids ज़्यादा रहते हैं, उनको भी sleep apnea के chances ज़्यादा होते हैं.
So
These are the risk factors. Then coming to the consequences. The important issue to understand is that when you have sleep apnea, two things happen. One is that your sympathetic, your CO2 comes down, your oxygen comes down, carbon dioxide rises. So there is this cyclic patterns of low oxygen, high carbon dioxide, which is happening in the body. These cyclic patterns lead to what we call metabolic dysregulation. उससे metabolic syndrome के chances बढ़ जाते हैं. Insulin resistance ज़्यादा हो जाती है. High chances of what we call fatty liver, diabetes, hypertension, and coronary artery disease. All of these are becoming an increasing risk factor, and therefore sleep apnea is not only causing loud snoring, it is increasing the chance of heart attacks, having irregular heartbeat at night, and also increases the chance of insulin resistance.
So it's got a huge impact on all the body parts. Literally, आपने
Correct.
जैसे stroke की बात कही, whether it's even insulin level को examine. What you said about, I wanted to just explain the link about, when the oxygen is going down, because that's exactly how my dad landed in hospital. His CO2 was 80 or something, right? And he collapsed. And मैंने फिर बाद में पता लगा it's a very common thing. People collapse. Some of them even have to go on the ventilator. It's just that he was in hospital when it happened. What really is happening, because it's not very heard of कि कार्बन डाइऑक्साइड लोग चेक नहीं करते. जैसे मेरे फादर के केस में they just kept trying oxygen and they didn't realize कि वो बाहर नहीं निकल रहा है. If you can explain that, because that's a big gap again.
So again, if people have what is known as underlying lung problem, then the carbon dioxide. So when you stop breathing, or airways collapse, एक तो oxygen कम होती है, दूसरा because carbon dioxide is not able to get out of the system, it accumulates in the body and your CO2 starts rising. If you have an underlying lung problem, especially people who have COPD, and COPD and obstructive sleep apnea is known as an overlap syndrome. Both of them sort of
Hand in hand.
drive each other or aggravate each other. So if you have that, then it becomes a bigger problem. So then your CO2 starts rising, and you start most people just look at the oxygen.
Yeah.
They don't look at the CO2. But CO2 itself, when it goes up, leads to more drowsiness. It leads to a person becoming more and more sort of less responsive. And it can lead to people landing up in the ICU and on a ventilator.
Yeah, that's exactly what happened. Okay, moving on, Dr. Guleria, treatment plans के बारे में बताइए. Once it's diagnosed, once one takes the onus कि मुझे sleep apnea है, test के बाद फिर हम कैसे इसे treat कर सकते हैं?
So there are multiple treatment options. I'll start with the simplest thing, that is lifestyle modification.
जी.
So if one is overweight, one should reduce weight. That is the most important thing. Early and light dinner. Don't take a very heavy dinner. That will also lead to loud snoring. Sleep on your side. So there are certain devices also which help you as far as positional therapy is concerned.
Okay.
If you sleep on your back, your tongue goes back, your mouth stays open, and you tend to cause more obstruction.
अच्छा,
So we
तो side
advise
sleeping.
patients to sleep on the side or sleep on your stomach, but don't sleep on your back. So weight loss, lifestyle modification, positional therapy are simple things that can be done.
So that's the first line of treatment
First
when you
line
try
of treatment
to, yeah.
and may be useful in people who have mild obstructive sleep apnea. So when we start looking at sleep apnea and we do a sleep study, we also grade it whether it's mild, moderate or severe. So let me just try and explain. Like I said, you stop breathing.
जी.
In a normal person also this can happen, but it's usually less than 5 times in an hour. In patients who have severe sleep apnea, it can be more than 30 times. We have patients who have this or 70 to 80 times. That means in what half a minute, they are
Stop.
their oxygen is coming down throughout the night.
So रुक के आ रही है, I mean, it's
So
like,
हर आधे मिनट में सांस रुक रही है और फिर वो सांस खुल रही है फिर रुक रही है. So that is a severe obstructive sleep apnea. In such people, you have to use a device known as a CPAP machine.
जी.
CPAP stands for continuous positive airway pressure. It's a simple device. It's just a pump which pushes air in. What it does is it acts like a splint. So आपकी सांस की नाली बंद हो रही है, हमें उसको खोलना है, तो हम एक मास्क लगा के एक मशीन लगाते हैं जो आपको प्रेशर अंदर डालती है. It gives a positive pressure, so it opens up the airways and it doesn't allow it to close. So we titrate to see what is the pressure that is required, and there are auto machines also available which do it on their own. So we give a pressure which could be 8 centimeters of water, it could be 12 centimeters of water, and that doesn't allow the airway to collapse. It keeps the airway open. एयरवे ओपन रहेगा तो ऑक्सीजन नहीं कम होगी, कार्बन डाइऑक्साइड नहीं बढ़ेगी,
तो सांस
सांस नहीं
नहीं रुकेगी.
रुकेगी और फिर जो सारा उसका इफेक्ट है वो खत्म हो जाएगा. एंड पीपल हु हैव स्लीप एपनिया वंस दे यूज द मशीन they find it makes a huge difference. The quality of life improves, all these parameters come down. We've had patients whose blood pressure medicines have come down by half, whose sugar control has become better, because all of this is driving the metabolic syndrome.
And your body organs are working properly.
Much
लेकिन I
better.
just want to go back. आपने कहा आधे मिनट में जैसे सांस रुकता है, right? ऑक्सीजन नहीं जा रही. So obviously that is when जब लोग कहते हैं sleep में they have a heart attack or something, that can be a
Yes, so you
reason.
can lead to arrhythmias because your oxygen goes down, carbon dioxide goes up, so you can have a higher chance of heart attacks, a heartbeat becoming irregular at night, and higher chance of having irregular heartbeat, which can lead to heart attacks but can also lead to strokes.
Strokes as well. Okay, just coming on to the machines. Any limitations आपने बोला जैसे CPAP के बारे. Also हमने देखा है market में masks होते हैं when we were looking. But because my dad has a severe one, you know, they said the pipes won't work. So थोड़ा उसके बारे में भी हमें बताएं.
So there are different types of machines. One is, like I said, a manual CPAP and auto CPAP. Now the machine is simple. You can also have a BiPAP machine depending on the type of disease that you
Severity,
have.
yeah.
Severity, and like I said, if you have underlying COPD. Then the other important issue is that the interface. The machine is the same. The most important thing is the mask. Because you have to really have a mask on your face which pushes air in and which contains a positive pressure. So some people need a full face mask. Others have a nasal mask, and some have nasal pillows. So there are a number of masks available, and what suits you and what is useful for you depending on the severity is what you need to discuss with your doctor and what you are comfortable with.
तो safety angle से mask ठीक है, कुछ limitations and machines के कि can a person use it lifelong?
You can use it lifelong. There are people whose life has changed so much that they not only use it lifelong, they take it with them whenever they travel, and they use it in the hotel also, because they feel that if they don't use it, they're not that alert the next
So
day.
it becomes a part of your living. I mean,
It
that's how
becomes
you're
a part
it's
of your
about
living.
managing sleep apnea. Dr. Guleria, क्या ये सच है कि men are more prone to sleep apnea और औरतों के लिए during menopause ये एक you see it growing? Is that true?
So men are more prone, it's more common in men.
Okay.
And women are protected to some extent. After menopause, because the hormonal effects change, the incidence, it's felt that the incidence becomes as much as it is in men. But as a whole, men are more prone to sleep apnea.
Okay.
There are newer treatments also available, and there are some drugs also which people try for sleep apnea. But there is a new treatment strategy which has been approved in the US for obstructive sleep apnea, which is basically what is known as hypoglossal nerve stimulation. So it's like a pacemaker device. It's a surgical intervention. They put a device here and they tunnel it right up to your neck. And when you're sleeping, you just put it on. And when you start snoring, it gives a small current to a nerve.
So that
The tongue sort of gets pushed forward and it opens it up. So that is also a new device which is available, which is now US FDA approved. It's still evolving, and there are people who use this as a hypoglossal nerve stimulation, which is like a pacemaker, which is also something that can be used. but the current gold standard continues to be CPAP.
See, and very soon maybe we could, who knows, it'll be in India also very soon once it's
Correct,
approved.
correct.
Yeah. Acha, आपने, since we said men again, I'm not being, I mean it's not about a gender thing, but how much do smoking, alcohol, ये late night partying, ये sleep apnea को कितना और बढ़ावा देता है?
So people who have sleep apnea, the obstruction gets worse if you take alcohol at night, if you are smoking, and like I said, if you're taking a late dinner and partying, all of these affect not only your the muscle relaxation, but the opening becomes, the sleep apnea becomes more severe, and it leads to more problems as far as obstructive sleep apnea is concerned.
डॉक्टर गुलेरिया, हम बात कर रहे हैं अबाउट लाइफस्टाइल, राइट? कुछ कनेक्शन है क्या स्लीप एपनिया और एक्सरसाइज का, या स्ट्रेंथ ट्रेनिंग का, या ऐसे भी कहा जाता है सर्टन ब्रीदिंग एक्सरसाइज लाइक भामरी एंड ऑल, ये भी हेल्प कर सकते हैं समबडी हैज स्लीप एपनिया? इसमें कितना सच है?
So if you have mild sleep apnea,
जी,
mild to moderate as a matter of fact, then lifestyle modification, exercises, and yoga and other things can also help to some extent. And like I said, positional therapy. Even in mild sleep apnea, although it depends on your structure, and that's why sometimes if we feel people have sleep apnea, we do also get an ENT evaluation done, because sometimes if there's a structural abnormality, surgery can also be done as far as the airway is concerned. So surgery is also an option as far as treatment is concerned in a small group of patients. But by and large, if you have mild sleep apnea, lifestyle modification, exercise, weight reduction will help you.
okay.
If you have severe sleep apnea, CPAP is the treatment of choice. You can sometimes, if there is an anatomical problem, surgery may help, and we have newer
Technologies,
technology
innovations.
also coming up. But by and large, this is the broad treatment out
You know,
there.
you yourself said in newer technologies, and we are seeing how it's growing even in this field of medicine. What about GLP-1 medicines like Ozempic and all? Besides, of course, controlling weight loss, do they also help a patient, or somebody suffering from sleep apnea breathe better? Is there a
So
connect?
there are medicines which have been used, and there are trials also. There is a trial which have used drugs like teriparatide, which is Mounjaro, for patients with sleep apnea who are not diabetics, and shown that the sleep apnea severity comes down. But the important thing to remember is it came down because your weight came down. So it's a treatment of sleep apnea in terms of reducing your weight,
Okay,
and
so-
that helps you. So if you are able to reduce your weight, otherwise also sleep apnea is useful. Before this, there would be a time when, and we did a study in this at AIMS, where we looked at bariatric surgery. People who were obese, they had bariatric surgery done, and after bariatric surgery, when they lost weight, the severity of sleep apnea also came down significantly. So
Weight
any
and
weight,
obesity plays.
exactly, any measure which decreases your weight if you're obese will also help your sleep apnea. It could be drugs, it could be surgery, it could be your own exercise
So-
and dieting.
So it comes back to the same thing. The other thing I want to ask is about melatonin. We see the usage of melatonin supplements being used a lot. Is it true that melatonin supplements can actually worsen sleep apnea because it relaxes the muscles? Is there a connect there as well?
Correct. So melatonin is not a treatment for sleep apnea. It's basically a drug which is basically for insomnia. It relaxes your body, it relaxes the muscles, and it's a hormonal therapy, so it's something which is more natural as compared to sleeping pills. But there are some studies which show that it can lead to worsening of sleep apnea because it relaxes the upper airway muscles, the pharyngeal muscles, and sometimes sleep apnea can get worsened. So I think one has to be careful about taking melatonin if you have sleep apnea and you're not using any other treatment for sleep apnea.
ओके, अगेन मिथ्स आपने अपने करियर में डॉक्टर गुलेरिया बहुत देखे होंगे स्लीप एपनिया को लेकर. एनीथिंग यू वुड लाइक टू शेयर विद अस, इन योर होल करियर स्पैन, वेयर पीपल एक्चुअली से अच्छा ये नहीं हो सकता स्लीप, या समथिंग व्हिच यू फील दैट शुड बी पुट आउट देयर?
So I think it's very important that if you have anyone who's obese and is a loud snorer, don't take it lightly. People feel कि नहीं ये तो नहीं हो सकता. I've had this problem because when we were doing this study, we used to, and we found this in children. When we talked to parents, parents were not willing to accept this, and they felt that the child who was obese and chubby was a good thing.
Yeah,
So
it's
they would
healthy
say कि
baby.
अच्छा हट्टा कट्टा बच्चा है तो आप क्यों कह रहे हो
खाते
इसको
पीते घर से आता है।
खाते तो इसको तो कैसे कोई बीमारी हो सकती है? So that is very, very important, that being hatta katta is not only, it's not a sign of good health, it can actually mean problems which could be related to obesity, sleep apnea, and metabolic syndrome.
And we really see obesity increasing in children as well, right?
Correct. That's what we also observe.
So, Dr. Guleria, as a parent, right, obviously I'm inquisitive to know what are the signs I should look out for, parents should look out for to recognize कि हाँ, because you always think, कोई बड़ा इंसान होता है तो आप सोचते बहुत थक गया तो तभी स्नोर कर रहा है, वी ओवरलुक इट. एज अ पेरेंट हमें क्या ऐसे साइंस देखने चाहिए कि बच्चे को शायद स्लीप एपनिया हो?
So, well, like I said, if the child is overweight, If the child tends to breathe more from the mouth, that means he's having more of a mouth breather, snoring at night. And again, if the child is less attentive, tends to sleep more during the day, feels not that fresh in the morning, just it's worthwhile to consult your doctor to rule out sleep apnea.
Okay, lastly, any advice you would like to give our viewers, our listeners who are suspecting they have sleep apnea, but they are like not really taking the first step to kind of recognize it or move towards, actually diagnosing it? What's the message you would like to give them?
So if you have any of the symptoms that we discussed today, you must consult your doctor, because this is something which can affect you not only from your snoring point of view, it can affect your quality of life, it can lead to a lot of problems which are heart related, neurological related, diabetes related, metabolic syndrome can get aggravated, fatty liver can get aggravated. So just don't ignore sleep apnea. Get it diagnosed, get it treated. It will really change your life.
So don't ignore it. I think that really is the key, and it is treatable, right? You can
It is
manage your
treatable.
life well, like you rightly said. जो लोग use कर रहे हैं machines, they are leading a happier and healthier life.
Much better life.
Thank you so much, Dr. Guleria, for giving us your time. And I think speaking on a topic which you said, numbers are going up, लेकिन awareness because of diagnosis are not accepting it, अभी कहीं ना कहीं lack कर रही है.
Thank you for having me. Thank you.